Today we are going to see a very important topic, and this is a definite topic in respect to community medicine. Okay, this is a very definite topic in community medicine, and we can expect a question, and we are having the questions for the last 3 to 4 years, so we can expect the same in INICET questions also. So we can let me go to the topic. Okay, myself, Dr. Kannan, Assistant Professor, Community Medicine. We are going to see the speed question. Welcome to Speed Initiative Preparation. Please update with your topic. This is the one topic, okay, which we are going to discuss. The topic which we are going to discuss is we'll go with this MCQ. In a 10-year-old unimmunized child, what are the vaccines to be administered? Option A, BCG. Option BCG, OPV and MR. Option B, pentavalent, MR. Or option C, MR and TD. Option D, rotavirus, BCG, OPV and pentavalent. So we will go with the topic discussion, then we come to the MCQ for the answer. So we will see the national immunization schedule. The national immunization schedule will go like this. This is the national immunization schedule. This is the national immunization schedule. At birth, what are the vaccines we have to give? We have to give BCG, OPV, hepatitis B. Hepatitis B is a birth dose. Okay. Why we call this a birth dose? Because this dose will prevent the transmission of hepatitis B from mother to child. And 6 weeks, what are the vaccines? OPV, DPT, hepatitis B, HIV, rotavirus, injectable polio vaccine 1 and PCV10. And I always tell in my class and repeat it again, if you don't know a vaccine dose, the answer is 0.5 ml. If you ask you what is the dose of rotavirus vaccine, the answer is 0.5 ml. Absolutely correct. If you ask you what is the dose of MR vaccine, the answer is 0.5 ml. What is the dose of corona vaccine? The answer is 0.5 ml. Last year when I was taking class, I told students the dose of corona vaccine will be 0.5 ml and it is absolutely correct. Okay, so at 6 weeks, these are the vaccines. Sometimes this DPT, hepatitis B, HIV together called as pentavalent. In some states, they are giving pentavalent. Hexavalent is going to come. So what is hexavalent? Hexavalent is pentavalent along with the IPV. Okay, when the pentavalent vaccine along with the polio, it is called hexavalent, which is going to come, which may come. It is already available in some of the private areas. That is, they are combining the pentavalent vaccine with the IPV. Next 10 weeks, what are the doses? OPV, DPT, hepatitis B, HIV, rotavirus. Remember, rotavirus is again a oral vaccine, okay, which is given in 5 drops. Okay, slowly one by one, we are going to see all the topics for the AIMS PG, which will be helpful for you because this is a one determined topic for the INICET exam. The next vaccine is the 14 weeks. What are the vaccines? OPV, DPT, again pentavalent, rotavirus, IPV second dose. IPV is given in what schedule is 0.1 ml intradermal. Okay, normally this is called fractional IPV. This is class fractional IPV. Fractional IPV is 0.1 ml. Normal dose is 0.5 ml. One fraction is given. 9 months, what are the vaccines? MR, vitamin A. Vitamin A is not a vaccine. Japanese encephalitis and the PCV10. The Japanese encephalitis is again all India question. The dose it is live vaccine and given subcutaneous. Again dose is 0.5 ml. 16 to 14 months, that is 1.5 years. We can give DPT booster, OPV booster, Japanese encephalitis and MR. 5 to 6 years DPT. 10 years it was TT. Now it is replaced by TD. Okay, it was TT replaced by TD. So now we can discuss that. From this slide itself, we have got a lot of other topics related to that. Okay, so the question asked in one of the All India question is, what are the recently approved vaccines? Rotavirus, PCV10, adult Japanese encephalitis, and the IPV. Okay, so again, the Japanese encephalitis is already there in the schedule. It is only given in the endemic areas. So these kind of questions will come definitely from this schedule. And remember, vitamin A is not a vaccine. MMR is replaced by MR. Okay, now coming to this part of the question where the vaccines and the age limit, another very important slide. BCG is given at up to what year? Up to what year? It is given up to 1 year of age. After 1 year we can give or not? Yes, we can give, but after 1 year it has no use. Efficacy and the BCG will come down. we are giving vaccines primarily as a primary prevention. Again, MCQ vaccines comes under primary prevention under specific protection. We are giving only to prevent the disease transmission. That is our main goal. Okay, the BCG vaccine at the birth dose is 0.05 ml. 0.05 ml is the birth dose. Okay, but 0.1 ml is the normal dose. Okay, because BCG is given intradermal. So intradermally, I cannot give more than 0.1 ml. Okay, so that is why BCG is given in the dose of 0.1 ml. In the birth dose is 0.05 ml because newborn skin is much fragile. OPV is given at up to what years of age? Up to 5 years of age. Hepatitis B already told up to 1 year of age. That too at the birth dose is more important, which is given within 72 hours of birth. It will prevent the transmission. Measles or MMR. We can include MMR also. Okay, including the MMR also up to 5 years of age. Okay, the up to 5 years of age. DPT up to 7 years of age. Japanese encephalitis you can give up to 15 years of age. TD or TT, otherwise called school vaccines, because at the age of 10 and 16, we can, I saw in the previous slide, it is 10 and 16, the students will be there in the school, so we have to go to school and vaccinate. There's no age limit. Okay. Rotavirus vaccine up to 1 year of age. Pneumococcal vaccine mainly to prevent the acute respiratory infection up to 1 year of age. MR vaccine, it was, this is a recent update, it was up to 5 years of age. Now this national MR vaccine campaign has started under Mission Indradhanush. Mission Indradhanush is to prevent the 7 vaccine preventable disease. In that MR vaccine also included can be give up to 15 years of age, 9 months to 15 years of age. Remember, this is a new update, 9 months to 15 years of age. Okay, this is up to national MR vaccine campaign, because measles there is a regimen called catch up, keep up, follow up. What is catch up, keep up, follow up? Catch up means we have to catch up all the adolescent people who are at the risk of developing measles, and we have to keep up. First, then we have to keep the children. Then we have to vaccinate them with 2 doses of MR vaccines 1 month apart. Again, MR vaccine dose, if I ask, the answer is 0.5 ml. It is a very basic MCQ nick. And then the next one is the second dose, 2 doses we have to give, especially if you're a female. If you're a female and if you are going to get conception, please take MR vaccine because of the increased incidence of congenital rubella syndrome. Okay, so I will repeat again this table. This table is so important because we are getting almost all the questions from this table only. BCG is up to 1 year of age. OPV 5 years of age. Hepatitis B 1 year of age. So BCG, OPV, rotavirus, PCV. I'll write again. BCG, OPV, rotavirus, PCV, pneumococcal vaccine up to 1 year of age. Okay. So if I next, what are the vaccines we have find out? Your BCG, hepatitis B, rotavirus, PCV. So BCG, hepatitis B, rotavirus, PCV, up to 1 year of age. If you, please remember that. Okay, you can use any number of mnemonic. The mnemonic which I use is BPH, main prostatic hypertension, or BPHR. We can use up to 1 year of age. Okay, then 5 years of age, OPV, measles. Okay, this will come up to measles or measles containing vaccine up to 5 years of age, and the MR vaccine can be given up to 15 years of age, which is the new schedule, because our primary aim is to cut the measles eliminations. Measles is the one disease which have a basic reproduction number more than 10. It is very high. That is one measles case can infect 10 to 12 cases. Okay, so let's come back to the MCQ which we have put. In a 10-year-old unimmunized child, what are the vaccines to be administered? Obviously, I cannot give BCG and OPV because I told BCG and OPV can be BCG up to 1 year of age, OPV up to 5 years of age. So this option is ruled out. Pentavalent and MR. Pentavalent, the DPT can be given up to 5 years, but 7 years. But the HIV and the hepatitis B component cannot be given after 1 year. So this option is ruled out. Rotavirus, BCG and can be given to 1 year, OPV up to 5 years of age, and pentavalent also cannot be given. So the answer can be given is MR, TD. If the option has TD or MR, suppose that one question coming TD and MR, the answer is TD, because generally measles virus cannot be given up to particulars of up to 5 years of age, but this is a new update of National Measles Vaccination Campaign. If the option has MR and TD, that is correct according to recent update in the thing. Okay. So, but if the option has TD and MR separately, we have to select one. Means actually both can be given up to 15 years. The TD, there is no age limit. MR can be given up to 15 years of age. There's no doubt there. But if the both option is given, which is better is TD. In that case, the answer is capital T and capital D. So please read the MCQ properly and write, because the games always will have a tricky question. So in that, if suppose the one question is given to 10-year-old unimmunized child, what are the vaccines you administer? Option A TD, option B MR, option C BCG, option D OPV. Okay, in that case the answer is TD, because TD there is no age limit. The MR is given according to the National MR Vaccine Campaign. By science or by logic, we should not be giving to the more than 5 years of age. By the logic, we cannot give measles more. We see the MCQ properly and right. But in this case, this MCQ, it's a recent INICET MCQ. The options were I changed according to the for this class. Okay, it is the MR and TD can be given in a 10-year-old unimmunized child. It is very common in the tribal area when there is lack of access to the vaccination. So read about vaccination and immunization very thoroughly, and this schedule and what are the age limit thoroughly you should study. Okay, because this one topic is very important topic and definitely come. Okay, thank you so much, my dear students. Tomorrow we will come with another MCQ, another topic, and that wish you all the best for the future exam. Thank you so much.
Best training, peaceful environment, PG medical entrance exam preparation were my expectations. I got them at Speed Medical Village in Kanchipuram. Today, I am a PG topper.
Speed Medical Village, a unique eco-friendly campus dedicated for PG preparation. Speed Medical Institute, a complete solution for medical education.